So I'm so excited to have Dr. Steve Shanbom with me today. And of course, we're starting late because we were busy off the Facebook Live talking. And then I'm like, okay, well, I guess we should go live and talk about all these great things. But, you know, in the face of COVID, you were seeing patients on an emergency basis, and now you're open. So I really want to start there, but in a minute. But where I really want to start is, can you give everybody a little bit of a background on who you are and a little bit of background on your practice?
Okay, well, good morning. I'm a local Detroit guy. I grew up in Oak Park and Farmington Hills, and went to Harrison High in Michigan State, and then Wayne State for medical school, and then even did residency here at Sinai, both in internal medicine and in ophthalmology. So that's a fact you may not know, that I'm an overqualified eye doctor, that I trained in internal medicine as well. But so I've been in practice for about 25 years now. Started at a practice in Southfield. I was up in Flint for a couple of years, and then bought a practice in Berkeley, Michigan. 1999, I joined the practice and then had control or bought the practice in 2001. It's a general ophthalmology practice, but we focus on cataract surgery, Lasik surgery, and then we also have an ambulatory surgery center affiliated with the practice. So we can do all of our operations right there without having to go to the hospital.
So when you, and I think that's one of the most key elements right now, we're going to talk about some things that make you a little unique, especially and I have a hard time saying post-COVID. I really do, because I just don't feel, it's me personally, I don't feel we're really in that post-COVID. I don't know what post-COVID will look like, but I feel as though we're in the trying to go back to some normalcy. What I really feel like is we're in a different stage. And so that different stage means that you're no longer just seeing emergencies. Your doors are open. People are making appointments that they might have put off, which is so important, because you really should not be putting off any medical appointments, but especially your eyes. You have two. They need to be healthy. And so at this point, the key message is that if you were due between March and now for an eye appointment, you need to reschedule and make that appointment. In your own office, what are you doing to assure people that it is okay?
Yeah, well, a little history about the whole COVID. We were, doing surgery and seeing patients in February, beginning of March, and middle of March, all of a sudden it was like, this is here, this is happening. And it was like decisions, like, what are we going to do? Do we shut down? Is everyone else shutting down? It was a very anxious time, and what are you supposed to do to keep everybody safe? And we shut the surgical center down second week in March. And then, with the governor talking about shutdown and stay at home, anything that was non-essential, we were, said to shut down. So then our clinical operations went down a couple days later. And so I was available for emergencies only in the office, and saw a few people, every day, because, frankly, in my business, there's not a lot of true emergencies that pop up. So anyway, we got back to the surgical center, open on June the 1st. So we're back doing elective surgeries, cataract surgeries. And then the office opened a week or two before that, slowly, opening it up to, more urgent cases, and now we're fully open. But with all the precautions, we're taking temperatures at the front door. We're asking all of the questions of travel and have you been exposed, and all the light questions that most offices, I believe, are doing. We're all masked, and we expect all the patients to be wearing a mask when they come in as well. Personally, I'm wearing the N95 mask because there are certain professions, mine included, where when I do an exam, I'm fairly close to the person's face.
Yeah.
What's interesting is the patients will wear a mask, and then I'll bring the microscope up to them, and then they want to take the mask off right at that point. I don't know, it happened. It's happened a few times. I'm like,
I think we're not used to this.
You're right. This is actually the time where you should have the mask on. So a couple awkward moments like that. But no, we're back, and people are coming out, and our schedules are getting busier.
I think what's really unique about your practice is this off-site surgical center, which allows people to have procedures done without having to go to the hospital. And I think one of the things that's really nice about that is, I think that in my view, or a lot of people in conversation, it's like, oh no, I don't want to go to the ER. I don't, I know, like the joke around here in my house is be careful when you cut something, you're not going to the ER, and it's just a joke. I mean, it's just sort of this joke, but anything, everybody's being a heightened awareness of being careful. And we know that our hospitals are separating people and doing all those things. But the truth is, there is something to be said about if you need to have a procedure done, just sort of being able to be in this
that peace of mind, that you're in a facility that has never seen COVID.
Mm-hmm.
We didn't have COVID patients, in the facility.
Right.
There's some peace of mind to that. Just, the ambulatory surgery center in general it's such a nice experience for me as the surgeon, but for the patient as well. It's a fairly quick visit. Everybody, is there, totally concentrated on them and what we are doing. And, in a general hospital, they're trying. They're, not that they're not kind and caring and good practitioners. It's just there's so much going on in those environments.
Right.
So,
they're dealing with all kinds of things. In your center, they're dealing with you and your patient. Yeah.
Right.
At this time, or maybe just in general, if people are looking to go to see an eye specialist, are there things that they should be asking, or expectations when someone comes in and says, I want to be a new patient, that they should be asking you?
That's an interesting question.
Well, and I ask that because I often think, if I'm going to be a new patient to a doctor, I find now more than ever we need to be our own advocates as a patient. I sit in the patient seat for a minute, and here, put you in the hot seat. You're a doctor, but you also can be a patient if you're.
Well, I guess the question is, why do I need to see an ophthalmologist?
Mm-hmm.
An MD vision specialist. And, when, especially as you age, about 40 years old, to be screened medically for glaucoma, for macular, for cataracts, for dry eye. I mean, there's a lot going on, that, you should have your eyes checked for, these issues, and a lot of things that we can discover just based on an eye exam by being able to see directly at blood vessels in the eye. We can make diagnoses of high blood pressure and diabetes just based on the eye exam. So
is that different than, is there a certain age that that it becomes more important to see an op?
I think age 40 and above,
Okay.
at 40, you start to have the near vision problems,
Mhm.
where I haven't needed glasses my whole life, and all of a sudden the menu print is too small. And
I have
you
no
know,
idea what you're talking about.
me either. But
You mean you can't run to one of those big box stores and just grab like the whole list of like readers and keep?
well, in the end, that actually does work, but it is troubling when it first happens. Like, it seems like overnight. It's like I could read yesterday, and all of a sudden I can't.
Mhm.
But that's around the time where people are going to come in and have a medical eye exam, and people should know what is the difference. An optometrist. The optometrists in this area are very, very highly trained, and they do a lot of medical diagnoses as well. Um, but when you have, say you have medical, well, how do I want to say this? My exam is covered by medical insurance, your
Mhm.
Blue Cross, your Medicare, your Aetnas, and whatnot. And we're going to be billing that as a medical visit. Now, I will do a refraction. I will check for glasses and contacts, but my practice is not a dispensary. I'm not, selling glasses and contacts, but I certainly can get a prescription, and certainly open for somebody who wants to have a good comprehensive medical exam. But also remember, if you have eye insurance, like iMed or something
Mhm.
like that, those benefits are very good for going to see an optometry doctor, a doctor of optometry, because they can do a great examination as well, and do glasses and contacts, and would be covered under that insurance.
So you and I talked not too long ago that there's all kinds of, they're not buzzwords because they're medical things that happen to you, but I say they're buzzwords because we talk about them and have no idea what they really are. We say things like, oh, I'm having my glaucoma test. I have astigmatism. And the truth of the matter is, I'll throw myself under the bus.
Uh,
Why not? It's my FaceTime. I have had astigmatism since I was 5 years old. I have worn glasses. You see them on me, right?
yeah.
Um, I have worn glasses since I was 5. No, I do not wear contacts. I am not sticking something in my eyes. I've never wanted to. But I have no idea what that actually really means.
Well, right.
There you
And
go.
so that's a
So,
great way.
so Dr.
Astigmatism.
Shanbom, tell me what astigmatism
What is
is.
that? Right. So it's one word. It's astigmatism. Because I'll often hear I have astigmatism. Right. It's
Okay.
the word is astigmatism as one word, and it really means aspheric, or out of round. So you think of your eyeball as being a ball. It's like a football. I'm sorry, like a basketball or a baseball. That it's a perfect sphere. And the truth is, very few eyeballs are perfect spheres. They may have some curvature more in one direction than the other, and that is what astigmatism is. It's an out of round eyeball. And you can imagine there are very few eyes that are perfectly round. And so many people have some degree of astigmatism, but not all astigmatism is going to cause a problem. Small amount of astigmatism, patients or people think, I see, reasonably well and don't need glasses. But the more astigmatic the cornea or the eyeball is, the more blurred the vision is going to be. Just like if you were nearsighted or farsighted, those are going to cause blurred vision. Astigmatism will as well. So to correct astigmatism, you wear glasses, and the glasses are ground, to counteract that. Yeah, to counteract that astigmatic cornea. In contact lenses, they talk about toric lenses or gas permeable lenses. Those can correct astigmatism. And then you move on surgically. Lasik has the ability to correct very high degrees of astigmatism. It's probably the best correction for astigmatism, even better than contacts, because even though a contact corrects it, every blink it's moving around and dancing around on your eye, so it's not giving you a constant clear image.
Is now there's always this debate. Are are most people, some people, not everyone, a candidate for LASIK, or is that has LASIK changed enough that people
Yeah. Well, before I get into that, let me finish.
Yeah.
Like the
Okay.
last surgical option would be cataract surgery. When we're
No.
doing cataract surgery, we're actually replacing the lens of the eye, and then an implant is put in the eye permanently. Well, these implants come in a toric variety as well, and so you can correct astigmatism at the time of cataract surgery as well. So.
And that could be at any age, because I always
Yeah.
think of, oh,
Well, cataract surgery is generally going to be, 50s, 60s, 70s,
okay.
but we'll see patients in their 40s who have developed cataracts, especially people with underlying illnesses and things like that. But everybody will get an implant at the time of cataract surgery. And so if
Okay.
they have astigmatism pre-existing that they've grown up with all their life, and they've been wearing glasses and contacts, I can now say to that person, well, we're going to fix your cataract and we're going to fix your vision by putting in an implant that will correct that astigmatism at the time of surgery.
It's good to know the history I'm about to take.
The
road I'm about to be on. I see the path.
Yeah. So your question was, who's a candidate for LASIK? So LASIK is a laser eye correction, generally for somebody younger, because what we're trying to do with LASIK is reshape the cornea, the front surface of the eye. So for someone who is nearsighted, we want to flatten that cornea. And if there's some astigmatism, we can also, correct that irregularity at the same time. And LASIK, like I said, is for a younger population. Someone who's wearing glasses and contacts, they're what we call pre-presbyopic. So they haven't gotten to that time where their eyes got old and they can't read up close. That they can see distance, they can see near, with their correction. We want to do LASIK so they don't have to wear that correction.
Does LASIK have a time length then? You're starting younger, but then how?
Well, LASIK has been quite stable for most people. Now, there are a small amount of people that will start to regress over time. I can speak, for myself. I had LASIK done for my eyes in 1999, and I'm still glasses free, and I was very nearsighted. I do need my little cheaters, my little glasses for up close, but it's been a terrific thing for me. Now, as you are 45, 50, 55, and you say, I want some of that LASIK for myself. Now it gets to be a little trickier because, you're going to correct the distance vision, but now you have this near vision problem.
Right.
And so we can get around that sometimes by doing monovision LASIK, where one eye is for distance and one eye is for near, which some people adapt to very well, and some people say, what are you talking about? I would never do that. So as you get into the 50s, towards 60, LASIK is less of a good option, and then moving to a lens-based surgery like cataract surgery, or we'll even do cataract surgery or the same process before you develop a cataract. We call it a lens exchange. So imagine this, you are 60 years old, you get, a cloudiness in the lens of your eye, and now it's a cataract, and we're going to perform cataract surgery. And we remove that cloudy lens and we put in an implant lens and correct the vision. Well, now say that lens isn't cloudy and hazy, and we can't rightfully call it a cataract, but a person really wants to get rid of their glasses and they want to get rid of their astigmatism. And we even have an implant, that will correct for the near vision as well. They'll say, well, I'd like to do that. Well, we can do that. It's the same process that we do for cataracts, only it can't be charged to the medical insurance at that point.
Is that considered more of a cosmetic? Is that?
Well, it would, yeah, it falls in
Is it?
cosmetic because you don't have enough medical reasoning for billing the insurance. So,
Okay.
we call it a refractive lens exchange. And we'll often use a multifocal implant, which would allow
Okay.
a person to see distance and near, no glasses. And
Understand.
what's nice about that is, both eyes are doing the same thing. So you're not doing one eye far and one eye near. And it's considered a lifetime treatment. That implant's going to be there for the rest of your life.
So around here in my own home, and I see a lot of people, and it was only a couple weeks ago, but yet I think it's still happening. In the summer in Michigan, it looks sometimes like it's snowing with the pollen and these trees. And, I have two boys and my husband all wear contacts, and they're rubbing their eyes and the allergies. And, what other problems do you see in your office this time of year? I mean, you probably throughout any season, but I find like the allergy season just to be like you're just constantly rubbing and
Yeah.
you know.
Well, it's particularly bad, in the spring and like you said, snowing in July.
Mhm.
That white stuff, what are the cottonwood trees?
I mean, are we
I
hurting? Are we hurting our eyes, or
I
you
don't. I
know?
don't think no, you're not necessarily hurting your eyes, but they're certain. They're definitely irritated and itchy, and if it's a true allergy, an over-the-counter allergy drop like a Zatador. Then we have prescription strength allergy drops. But greater than allergy is dry eye is like epidemic. Everybody seems to have more and more dry eye, whether it's environmental or whether it's aging. It can be related to medications that you
Can you
take.
can you explain what I've been hearing that in the news more, and I don't know what that really means, because
Yeah,
now I know that my eyes will itch and feel dry, but I don't really know what dry eye really means.
yeah.
Like,
So the typical symptoms of a dry eye are your eyes feel heavy, they feel tired, they'll feel like there's something in there, like this foreign body sensation. You find like you're like blinking your eyes to clear up your vision. You can get like crustiness or like what we call sleep, at the edge of the eyelid. Sometimes even like a mucus discharge. All of those are in the dry eye category. And the other dry eye symptom that's kind of ironic is the eye will tend to overwater in certain situations. So imagine your eye is kind of dry, it's kind of irritated, then the wind comes and blows into your face, or like from the vents in the car, or maybe just even walking around in the mall. There's a lot of air currents that are, the next thing you know, you got like a little drip, like a tear running down, like where'd that come from?
right.
And truly the base of that is dry eye. And you try to explain that to the patients. It's like, they come in and say, my eyes are watering all the time. And I have to tell them, well, you have dry eye. And you say, well, I'm not crazy. It's really true.
And what do you do for dry eye?
So the treatment for dry eye is, you start with an artificial tear, just a lubricant drop. Typical brand names are like Refresh, Sustain, TheraTears, Blink.
I've seen those around my house. Okay.
Yeah, okay. And some of them are even made for contact lenses.
Yeah.
That they're mild enough that you could use it as a re-wetting drop while you have your contact lens in. But when I'm going to talk to the patient about dry eye, that's where we're going to start. Is we're going to do artificial tears, and if that works, then that's great. The next level would be a prescription tear drop. You may have seen commercials for Restasis or Zydra. These are drops that are taken twice a day. They are prescription, and they have some anti-inflammatory properties, because dry eye becomes an inflammatory disease, and it actually helps the eyes make more of their own tears. So that's a different mechanism than just an over-the-counter tear, which feels terrific when you put it in, but 15 minutes later it's gone and you're back where you started. And then another thing we use quite a bit is something called tear plugs. What a tear plug is, well, to go back, how the tears are produced here in the lacrimal gland, which is actually on the temporal side. The tears wash across and they pool in the corner right next to your nose. In the edge of the lid, there's a tiny little hole called the punctum. And there's one on the bottom and one on the top. And so the tears then drain through that little hole down into your nose. So if you cry, you got to blow your nose because that's where all the tears end up.
Yeah.
If you block the lower hole, what happens is the tears that you do produce will hang around longer. It kind of acts as a reservoir, the tears that are not leaving the eye quite so quickly. Now we leave the upper hole open as a safety valve, so you're not going to over tear. But these tear plugs work remarkably well. They're easily put in the office and well tolerated, and it's very homeopathic, right? You're using your own tears to help yourself. So I like that treatment a lot. It's the plug I use actually goes down below the surface, so you don't feel it, and it will dissolve over the course of 6 months. And if it works and the patient's happy, 6 months later, I'll see them. Hey, how you doing? If you're starting to have symptoms again, we'll put another plug in.
That's so fascinating.
Yeah,
very fascinating. I'm excited because one of the things we've talked about is that you're going to be adding all kinds of information like this to your own website. And so people can really learn a lot. I mean, I feel like I've learned so much today. What do you think is what makes your Shanbom Eye Specialist so unique? What do you?
Well, what
You've
makes
been doing
us
this
unique.
a long time.
Yeah. Well, I have experience. That's one thing. But more than that, I like to think of my office as a family. My technicians, my biller, my manager, everybody is going to treat patients like I would treat my own family. And I've always taken pride in that they can, feel comfortable in my office, and that I'm going to give them advice that I would give to my family.
Yeah.
So that's one thing. The other is technology. I've always embraced the latest technology. So we're doing cataract surgery with a laser. This is laser assisted cataract surgery, which is relatively new. It's a gentler, way of doing cataract surgery with some accuracies that you can't provide just manually.
I think that's really important for people to really embrace, because it really makes you stand out as one of the premier specialists in that area. So you're talking about your eyes. I mean,
well, like you said, you got two. That's all you got, right? And so,
right.
Imagine you're having surgery. You want to do it the best you can.
Right.
And have the best technology, have the best implants, and be given the best advice on what's going to be good for you. Because like you said before, who's a candidate for Lasik? Well, who's a candidate for a multifocal implant? Who's a candidate for a toric implant? Not everybody is going to be the best for all things. And that's how I feel our practice is well situated in being able to give advice on what we think is going to be the best way to correct somebody's vision.
Well, I want to thank you. I never like to take a doctor's too much of their time, because I know that, like, in this day and age, while you're still seeing patients, you're also still following up in telemedicine world and doing a little bit of both. And I'm so thrilled to have this time with you today, especially because I learned so much every time I talk to you. I'm looking forward to getting more information and seeing more information on your website. Tell everybody where they can find you.
Well, my office is in Berkeley on Woodward, just south of 12 Mile.
And your website?
Website is ShanbomEyeSpecialist.com.
And that's probably the best way to go. And you can...
Yeah, the phone number. Well, no one's going to take down a phone number.
Right, but the phone number is there on the website.
Yeah.
But I think it's really important if you have questions, you know, you can go to the Facebook, Instagram, website. I think, you know, in this day and age, I say this a lot about any industry, especially medical, you need to advocate for yourself. You need to ask questions. People, you know, you need to know what your own body is doing. Your eyes are important as we do get older, you know, and, but it's the same thing. You need to ask questions, and we're in a really unique time. And so it's, you know, when you're going back into doctors' offices, you want to feel safe and secure. And so, you know, when I say to you, what should people be asking, you know, as they call your office, they're going to find out that you're taking all the protocols, how to come into your office, and then also be able to ask about, be able to see you and ask, you know, what you need to keep your eyes healthy for a long, long time.
Yeah. No, I'm excited about, you know, we have a project, you and I, to produce some videos and get some of this education out to people. It's something I've been wanting to do for a long time. And some of the topics we talked about today,
Yeah.
you know, that like you said, I think are common sense that people, you know, but you know, they don't. And I love to be a source for education on that.
Yeah, I mean, I've said to you, I think that they are common sense in that we all say the language, but we don't necessarily know what it means. Or sometimes, you know, we talk about it, but we really want to know more. And so now it gives it a place to find out more information. And sometimes it's just behind your own computer.
Yeah.
You know, I always say, don't be an expert, ask an expert. And so, you know, I say be an advocate, but ask an expert.
Okay, that sounds right.
So that's you know, how I, you know, try and look at it. But have a great day. I'm so glad we got this time together, and hope everybody got, you know, some great information out of talking with you.
Great to be with you, Sari.
All right. Talk to you later.
Right,
Bye.
bye-bye.